Hello and welcome to Clean Talk. I'm your host, Brad Whitchurch. We are coming to you live from the Seal Shield Studios in beautiful and hot downtown Orlando, Florida. Very excited to have my guest with us today. Joe Elliott is with Highmark Health. Joe, welcome to the show.
Hey, thank you, Brad, for having me. Much appreciated.
Well, really excited to get into it with you here. And I know many of our audience members are probably wondering, I have to ask you right out of the gate, what's it like being a rock star?
My Def Leppard days are over for right now.
That's right. So rock and roll fans will know that Joe Elliott is the lead singer of Def Leppard, the rock and roll band, but no relation?
No, not at all.
Well, tell us about what you actually do in your role at Highmark Health and why you're on Clean Talk today, Joe.
So I work again for Highmark Health. We're rebranding to enGen, which is the IT arm of the insurance side of Highmark. And then we also have the provider arm, which is our AHN network. And then the reason that we're here is because on the provider arm, we're using, not only do we use the Seal Shield keyboards, mice, the type of those peripherals, but we also are using the ElectroClave. And so that's really the big thing for me is my team handles the ElectroClave when it comes to all of our cell phones, tablets, things like that.
Fantastic. Well, I can't wait to unpack all that. We'll get into the ElectroClave and the workflows that you're using at Highmark Health. But maybe you can tell us a little bit more about your background and what it is that got you involved with Highmark.
So I came to Highmark right out of college. It was an intern type program, ended up staying, really enjoyed it. I started out as just an analyst working in the VDI space, kind of grew my way up, architect, etc. And then now I'm the manager over all of end user computing.
Well, fantastic. And so that's kind of rare in these days to have that type of longevity. How long have you been at Highmark?
So I've been there for 10 years.
Wow, that's fantastic. And tell us a little bit more about, you gave us the introduction to Highmark, but maybe tell us a little bit more about Highmark services and what your core competencies are.
Yeah, so we are Highmark Blue Cross Blue Shield. So we're based out of the Pittsburgh region, Western PA. We have an arm in Western Virginia. We have an arm in New York, which is our Health Now affiliation. So it's now Highmark Health New York. And then we also have some central Pennsylvania area ties there. And that is all for our insurance area. On the clinical side, we own AHN, which is Allegheny Health Network. That's our hospital system. I believe I think we're up to 8 hospitals now. Multiple cancer centers, and about 600 ancillary offices.
One of the largest healthcare systems in the country, right?
Well, I don't know about the country, but definitely it's the largest in the Pittsburgh area, for sure.
Fantastic, fantastic. Well, I know we wanted to talk a little bit about the enGen branding. What's that all about?
So it's actually pretty unique, Brad. So what Highmark noticed is that IT isn't just a commodity anymore and like, oh, we need it, but like it's like having the lights, right? You take it for granted. They recognize that IT is what's helping grow the business. So rebranding into this enGen is actually taking us out for profit, right? Like, hey, we need IT to grow our services. So that's the idea, is IT is really now a full-on service.
And of course, IT is so critical to improving patient and practitioner outcomes. And now with EHR systems, integrating all of that data and being able to make decisions on it is now an opportunity that just really wasn't around a few years ago. It's become a critical part of the healthcare practice.
I mean, look at everything you do now in any of these spaces. They're all driven by technology. Right? I mean, we need to be more mobile. The doctors need to have more technology at their fingertips, and again, be able to do more. So yeah, I mean, technology is the driver for all of this.
Well, and you talked about being more mobile. We've certainly seen a huge trend towards telemedicine recently. The telemedicine has been around for a while, but as a result of COVID, we've seen more adoption of telemedicine. What other kind of things have you seen as a result of COVID, either changes in the industry or changes within your own organization?
So, I mean, COVID obviously, I think, revolutionized the telemedicine market, right? A lot of the hospital systems were averaging, a few hundred visits in an hour, right? Now they're averaging a few thousand visits in an hour. So we've seen that grow exponentially. I think one of the biggest things that we've seen come out of COVID is the need to be more mobile, right? We're seeing people ditching laptops, desktops, tablets are being, forefront of everything. So I think you're going to see that, this is bringing a new wave of how we do business.
And that's really leading us into the topic that I want to dive into. Mobility in healthcare. A lot of the major EHR systems are mobile centric, right? So they're using, as you mentioned, tablets or smartphones. But now, and it's been suggested by some, that the smartphone is the most dangerous device in healthcare.
Correct.
Because it's going to areas of the facility that weren't necessarily ever accessed by a single piece of equipment before. There's cross-contamination risk. So we are introducing technology to improve patient and practitioner outcomes, make us more efficient, but it can come with some challenges, right?
Definitely. I mean, think about you with your phone, right? I mean, people take them everywhere. They go to the bathroom with you, they go to anywhere that you are, right? So that's what's happening. iPads, all of that. That is now just, you see kids with them all over the place, right? And again, you come out of your car, you touch a bunch of stuff, you walk into your hospital to go visit a loved one, right? You don't know where this person was. Cross-contamination is just going to be insane. Again, that's part of this culture of mobility, right? We just want to be more mobile.
Well, one of the great applications, I guess I've heard, is that highly immune compromised patients who weren't able to visit with their loved ones in the past now can have some communication with a tablet device without risking infection, assuming that tablet isn't a cross-contamination for a pathogen path, right? And
Correct.
so how do you address the need for infection control that has come about as a result of the implementation of new technology? Can you talk about what you guys are doing to protect your mobile devices and the practitioners and patients that are utilizing those?
Yeah, so I mean, what we do right now is, we have shared cell phones. It's very common in the health industry, right? Nurses will, badge in for a shift. They'll have to get a phone. That phone is checked out. They take it with them for their entire shift, 8, 12, 16 hours, right? And when they check the phone back in, right? Previously, they were using some type of Sandy wipes that you're not supposed to use on cell phones, but you have to do that or else there will be contamination, right? And that just brings in its own challenges. So for us, what we're doing is we've hooked the ElectroClave, right? So I know you don't know what that is, right? You don't know anything about it.
Maybe our audience needs a refresher on what the ElectroClave is.
So the ElectroClave, right, is a tower that has UV lights, right? And inside of there, you place your device. You can use it for masks. We've used it for other things than just cell phones, right? So you can put it in, and then within about 90 seconds or so, right, it is, I think it's down to a six log, reduction. So again, for us, what we've done is take a lot of hospital systems were using docks, like a datamation type dock or something like that. We're now replacing it and using the ElectroClave as your storage unit. So we're putting the phone in, the tablet in, whatever it might be, we're placing that inside the ElectroClave. Once you put that in there, right, there's a charging port, we'll charge the device. And then when the user needs to check the device out, right, they'll badge in, it'll show them what device to take, and they take it. All of this, right, can be done while it's being sterilized. So for us, it's kind of a win-win. Real estate in the health space is, hard to come by. So we're looking at ways to, put in things that will enable the customer, whether it's, our patients, our nurses, to be able to do what they need to get done and have benefits, right? So this is, a multifaceted approach. We're getting sanitization out of it. There's, tracking, big thing, FDA requires massive amounts of tracking. How often is it being done? That's what the advantage with the ElectroClave, tying that with the MDM solution. It's just a win-win.
Well, I love that workflow, and I love that you're having fantastic results. And you talked about that in your facility, you're using shared devices.
Yep.
That's very common in healthcare, but some healthcare facilities are using a bring your own device type of workflow. And even in that situation, even though it's your device, you want to make sure you're not bringing pathogens into the workplace or taking pathogens home with you. But how critical is it if you're using a shared device in what's potentially an infectious environment, that you have that confidence that this device that is not under your personal control all the time has been adequately sanitized, and that because of the tracking system that the ElectroClave is using?
I mean, you need to know, right? Like, because when you take a device out of a cabinet, you don't know who the last person that had it, right? Even your own cell phone, sometimes you don't know where you lost your phone before, right? That's why there's apps for losing your phone, right? So again, there's big reasons why you need to track this stuff. It's paramount to understand that the device is clean, sanitized. One of the things that, we're going to start exploring is breaking our workflow out into the patient area, right? So especially think of, you brought it up earlier, where, immunocompromised folks like cancer patients and stuff like that, right? If you're coming into a facility, right, I don't know what they touched beforehand, all the knobs and stuff like that they then held their phone. So one of the things we're looking at is, can we place one of these before they even come back into the area where they're going to get, their chemo or something? Can we put this there and have them sanitize their own device, right? I mean, they're not going to hook it into anything. There's no, we're not looking at your phone, but hey, you can clean it. And then that's just one more level of sanitization that we can give to our patients to hopefully help them understand, hey, this could be, a big risk if you don't do things like that.
That's right. And implementations, workflows for guests and visitors as well. So
exactly.
Make sure you have a clean device and that you've washed it, just like washing your hands before you go in.
Yeah. I mean, if you think about what COVID brought on, right? I mean, hospital systems, ours, I'm sure all over the US started limiting the amount of visitors that you could have, right? So visitors was limited to 1 or 2. When you did come in, you had to wash hands, wipe everything down. Some places even you took out everything in your pockets. They wanted, keys and all that left in a separate area, right? But people never really thought about the phone. I mean, most people brought the phone in, they FaceTime with a loved one. That's great. But that phone could have like 1,000 different things. And that's a carrier of all these pathogens that no one's really kind of thinking about, right?
Absolutely. So let's back it up a little bit. We've implemented mobile devices in healthcare to improve efficiency, to improve patient and practitioner outcome. With that comes some challenges. How do you clean these devices to make sure they're safe? You mentioned the Santa wipes can be a problem because they can actually etch out those screens over time, right? And it makes the phone less useful. As you may know, Seal Shield has a UV resistant screen protector product that we can put on those phones so that you can wipe them without damaging them. And then it also protects from UV radiation. You talked about using UV disinfection with the ElectroClave, UV sanitization to make sure that those devices are not only tracked, but that they're clean when they're being used by a new person because they're shared devices. And then the importance of the tracking piece, right? So
Yep.
you can clean it, but unless you know it's clean and unless you can prove it in an audit,
Right.
it didn't happen.
Exactly.
Right.
Yep.
So that's kind of the workflow, the cause and effect of what's been happening and what you guys are doing at Highmark, at least in terms of the mobile devices. Right?
Correct. Yep.
Right.
Yeah. And I think the key thing, right, is the tracking piece, right? So I think people take for granted a lot of those things, but the proof is really, to what you just said. If you can't prove it, it didn't happen, right? And I think we see that even like Sani wipes, there's no proof, right? It really,
No tracking,
there's
yeah.
no track. We don't know, right? Other than when the can's empty, that's about the only way, right? So I think that's a real big thing, for folks to understand.
Well, and some of our audience members maybe don't understand how the tracking on the ElectroClave works, but each device, so each cell phone in your system has an RFID tag on it, right? So each
No,
device is tagged?
actually, no. So actually what we're doing is it uses our MDM, right? So it's tied in and it knows, it speaks
Mobile device
to,
management.
mobile device management. It will talk to the ElectroClave. So it knows like this device with this MAC address was, sanitized at this time. So there's, full logs, we keep them for, I think, 3 years. So again, those are the key things. And, and then the other piece is the badging, right? So the user badges in. So we even know what user badged in and got a clean device.
Right.
So the soup to nuts.
And it incorporates with your existing badging system.
Correct.
Right? So everyone has their ID badge.
Yep.
It's got an RFID antenna, right? They tap and then they're logged in. And so you can keep track of, exactly who had a certain device. And if, God forbid, it turns out that you identify an issue that is tracked to a device, then now you have the ability to backtrack and figure out who potentially has been exposed.
Correct.
And you can take action against that. Right?
Correct. Yeah. So again, there's nothing, new that we had to bring in. We didn't have to reinvent the wheel here. It's a very common practice to have a badge with, readers already throughout the health system. So you just hook that into the ElectroClave, just adds on.
So it works right into your workflow.
Easily.
Yep. It. What other kind of things, if any, have you seen either as a result of COVID or as a result of additional focus on HAIs, hospital-acquired infections? Do you see any other kind of innovations that you've either implemented or that you're looking at that maybe help address this issue?
So I think what we're going to be seeing more of is, again, I think COVID brought a renewed interest in sanitization that maybe was in the back of people's minds, or maybe not in minds at all. So I think some of the things we're going to be seeing again is stricter standards around peripheral devices, right? So keyboards, mice, and then I think what we're also seeing is, with scanners, portable devices, screen protectors, those types of things, because not only does it break down the screen, but it'll break down the plastic. It removes, the lettering on the keyboard for those, and then they become useless, right? So what we're seeing is a renewed interest in how can we keep these devices clean and, not hinder the life cycle of the device. Instead of getting 4 years, we're only going to get 1 because we have to pour bleach on it every day.
Right. And actually, a lot of people aren't aware, Joe, you probably know that UV light can also be very damaging to devices. And as you're probably aware, because I know you've done your due diligence, the ElectroClave uses a very narrow bandwidth of UV light, which is just the efficacious range. Because we're using UVC LEDs as opposed to the standard UV generating mercury bulbs that are in most devices. The benefit is that there's no material degradation. So if you use a broad spectrum UV source, you're getting pathogen sanitization, but at the cost of material degradation, meaning the plastics, as you mentioned, are starting to break down. And what we see under an electron microscope is that it actually creates these micro fissures that you might not see initially with the naked eye, but it's a harbor for bacteria and they can get in there. And so you've implemented UV light because you want to help address this the problem of sanitization, and you may not be aware that over time you're making the problem worse because it's a broad spectrum solution, unlike the ElectroClave, which gives you 360-degree sanitization with no material degradation. Was that a factor in your decision?
It was. I mean, think about it, right? We're here in sunny Florida, right? There's probably some UV light, I would think, maybe around here. Think of all the plastics that are out there, right? And you know, you put a plastic bucket out for the kids in the pool, right? And 1 year later, the bucket's brittle and it falls apart, right? So it's the same thing, right, that happens with electronic devices. Most folks don't realize, but like, you know, cell phones, case, all those are plastic, right? So for us, we wanted to implement something that wouldn't compromise the life cycle, because as we all know, right, these devices are pretty expensive, $1,000+ a device. There's scanners that we have that are in the $10,000 range. We can't be replacing those every couple months because of it. So yeah, it is a big deal. And that's something that, you know, I encourage folks to make sure they fully understand what they're doing, because yeah, there are problems when you just go out and buy a regular UV light.
Absolutely. And that's a great explanation of that. And you mentioned the cost of these devices, and that comes back to the value of tracking as well, right?
Mm-hmm.
So you have some visibility on who had that device last. If it doesn't get turned in, you know where to go. And so these devices may be getting damaged by the infection control protocols, whether they're wipes or UV. And unless you have some sort of tracking of the inventory, there's a lot of product that walks off the campus, right? So you're protecting the cost on an asset basis as well as on the infection control side, right?
Exactly. So I think that's another thing, right? So some folks could even use the ElectroClave just for asset management, right? Yeah. I mean, there's some advantages of these workflows. So for us, yeah, I mean, it kills two birds with one stone. We know Susie Nurse has, you know, this phone. We know she put it back into the ElectroClave. We know the next person that came in was Johnny. So if there's 4 phones missing, we probably know it was Johnny, right? So yeah, there's definitely some advantages to these types of workflows.
Fantastic. Well, what other kind of things are you guys doing at Highmark these days? I know that we've done some trade shows together. What's coming up for you guys?
So for us, I think will be I think Vive is what it's called now, right?
Vive, yeah.
And then
Chime Vive.
Chime Vive, yep. And then possibly Hymns will probably be the next thing for us. Yeah.
So coming up in the springtime, right?
Yeah, yeah.
The show tour in spring.
The March, April timeframe. Right. Yeah, the road show. Yeah.
Fantastic, fantastic. What other stuff are you guys working on? Is there anything else you'd like to share with our audience today?
Again, I mean, I think for us, right, we're seeing a huge influx in that mobile space. Our mobile demand has grown exponentially. We're seeing a lot of new use cases for you know, different apps on the phones, right? A lot of the different patient trackers and stuff. So I think, again, mobility is going to be a huge thing in the future. I think we're going to see folks just migrating away from traditional methods and working more on the phone and the tablet.
I'm going to put you on the spot because I know you're a technology guy and we love technology on this show. What's the coolest thing you've seen recently that in the technology side of things?
So I think the coolest thing, and we're actually going to be implementing them soon, is the Samsung Folds. So we're actually going to start implementing those. So the foldable screen, I think, is pretty neat. We have a couple use cases we're going to start using that for.
Very nice. That's the second coolest thing besides the ElectroClave.
Correct. Of course. Right. Yes, of course.
Second coolest thing you've seen.
We've seen the ElectroClave for a few years.
Right.
So.
That's right. Okay. Fair enough. Fair enough. Well, I guess I have to ask you in closing, Joe Elliott, what is Joe Elliott's favorite Def Leppard song?
You know what? I like it all because my dad was in a band. I've grown up listening to it, so I like it all.
Amanda says, "Pour some sugar on me." It's the best song. Any predictions for the future on the IT or healthcare side that you want to share with our audience?
It's only going to be more demand. Like it's growing like crazy, and I think we're in a very good space. And well, I think we have some job security.
Oh, well, that's good. You got to enjoy that. Yeah. Obviously, we know that the shortage of workers in healthcare and a lot of the struggle that is going on for healthcare facilities and their workers.
Yeah, it's brutal. I mean, nurses are hard to come by. I feel for these places where we're struggling just like everyone else. So yeah, I mean,
what do you think the solution is? Is it do we have to get more nurses in school? Is it a wage issue? Is it what do we do to solve the problem?
Yeah, I don't know. I think there's definitely a shortage for sure. I don't necessarily know that it's the wages as much as it just we weren't ready for this type of event, right? This pandemic, and then coming out of it, right? I think we have some folks that are burnt out. That's not helping. And then just need to get more people in that career field.
Yeah, we need to get more people in and continue to leverage these technology solutions that will make those people more efficient.
Exactly.
Fantastic. Well, Joe, I really appreciate you being on the show. Appreciate you joining us here live today on Clean Talk. I've been your host, Brad Whitchurch, for my guest, Joe Elliott. Thanks for joining us, and be sure to join us next Wednesday at 3 p.m. Eastern Time and every Wednesday at 3 p.m. Eastern Time for Clean Talk Live. Until then, remember to keep it clean.